present a very recent research review on the use of social media interventions for autistic individuals. This is a research that is at the moment under review. It has been submitted, it's not published yet. And we have done it in collaboration with Inger Skaffel, that she was presenting before, with Anders Nordahl Hansen, that it was the first presenter, and with Rolf Wynn, that is sitting here in the room. So, yeah, let's start with this. This is a systematic review. So the background of this is like as you know, individuals diagnosed with autism spectrum disorder, they have persistent deficits in areas like social communication, that it has been told before. They have difficulties for interaction. And autism is also characterized by restricted and repetitive behaviors. What we know about the research on the traditional behavior interventions, this is a mix of evidence. There is evidence showing that these traditional interventions are beneficial for improving cognitive abilities and motor skills in autistic individuals. But there is also evidence showing that traditional interventions do not improve communication. They don't improve adaptive behavior or socialization. So, yeah, there is a mix. There is also research that shows that when we're using ICTs, computers, tablets, apps, that they are delivering behavioral interventions, we have, again, mixed evidence on the benefit for autistic people. Some research show that the use of technologies, it helps to improve social skills, to improve social behavior, social communication, and also facial emotion recognition. But there is also good research showing evidence that the ICTs don't help to improve social communication. So we are all the time good and perhaps not better improvement. But what happened with the social media? I think I'm a researcher on social media. I think that social media is a technology that can be used in interventions addressed to autistic individuals. And why I think that? I think that our social media could be used because both autistic adolescents, youth, but also adults are on social media. They are there, they are using it, and they are strong users. This is a screenshot, of course. This is just people talking about autism. It's blurred, but that's a real image of autistic people on social media. However, this is just what I think is something that it can be used, but there is not much knowledge about this. We don't know what's the efficacy of using social media for autistic, in interventions for autistic people. So then we wanted to explore what did this know? What's the evidence on this? So we have done a systematic review to describe the current existing evidence-based research on the use of social media in interventions that are addressed to autistic individuals. So we did this systematic review, we registered a systematic review in Prospero, and we did the search. We did the search 2 times. We did 2 searches. One, it was done in July 2022. And the last search, it was repeated in October 2022, so we're talking about last month. It was repeated in order to identify possible new publications from very fresh publications on the topic. It was an exhaustive search and databases. We searched in 8 databases. We use PubMed, Embase, Cochrane Library, PsycInfo, ERIC, Education Source, Web of Science, and IE Explorer. It was a broad search that it didn't have any limitations regarding date and regarding language. So any publication was welcome. As long as the publications were dealing with autism, of course, they were describing interventions that the intervention used social media somehow as a main way of delivering the intervention or as supplementary tool for the interventions. And we included as well studies that are reporting any type of results. So this means that the study protocols, letters to editors, this kind of publications, they were not considered. But we consider reviews. So primary studies and reviews were considered of interest here. And the primary studies, we assess the level of evidence using the tool GREAT. And the systematic reviews, we assess the risk of bias with AMSTAR. So that's our criteria that we use to classify these 2 tools, classify the research about regarding if are low quality, moderate quality, or high quality. So we can have an idea of the high qualities are the ones that are evidence-based. So we analyze as well. We extract the study design, the type of interventions, the focus, the type of participants, social media, etc. And we analyze the interventions components using the behavior change wheel framework. So we identify what type of behavior change it was used there and the effect of the interventions. And this is how it went. So from the search, we started with a huge number of publications. We went almost 3,000 in total we identify. After the screening, we end up with 9 publications. And what we had in these publications. These 9 publications, we have 3 randomized control trials, where these randomized control trials, they were using social media to educate. For example, one of studies were using social media to educate autistic individuals to brush teeth properly. Another randomized control trial was about increasing physical activity. So social media was used to promote increasing physical activity and also to improve occupational performance. We also include one systematic review that in that case, social media was used to provide information and social support to autistic individuals. And we include 5 studies that were not randomized or not systematic reviews. And in these 5 studies, social media intervention was to increase physical activity and also to improve social skills. When we analyze the level of evidence of these studies, of the what we found that mostly similar to what it has been told before. There are some 4 studies. They were of moderate quality, so we can consider that what it was found there is some evidence. So there is evidence. It was 4 studies with low quality, so what the evidence from there, it has to be taken carefully. And 1 study with we considered as very low quality. So the findings from this study should be analyzed more in depth. So in these studies, the participants in total, the interventions were covering 164 autistic individuals, and they were in autistic people between 5 and 22 years old, so very young kids and very young people. And in these interventions, it was used mostly Facebook in all their possibilities, private groups, secret groups. It was 5 studies using this. 3 studies delivered intervention through WhatsApp, and 1 study used YouTube in the intervention. And then we analyzed the behavior components that they were used in this intervention, and we identified that it was one of the components, which was education. It was used by all primary studies. So education is one of the interventions components that is used always. And then 6 studies use training, and 6 studies also use modeling in their interventions. But what is the effect of these interventions? Was social media doing something? What it was reported? So we highlight first the findings from the moderate quality studies, which are the ones that we have some evidence. We can trust what it was found there. So the studies with a moderate quality, they have report significant positive effects of using social media for autistic people. It has been reported that there is higher social engagement, significantly. A significant also increase on physical activity level. Also, there is an increased improvement on occupational performance. And also, this study that it was training autistic people on how to brush teeth, it has demonstrated that it was a decreased plaque scores. So there are several positive effects of using social media for autistic people. So it looks that it works. And the studies that they use, that they were considered of lower quality, they also have reported some benefits. But we have to take this a bit more carefully. But there are some benefits as well. So they have reported satisfaction of the parents. But they also, it has been reported some increase in social media skills. So the autistic individuals, they know how to navigate on social media more safely. And one study, it found that there was no difference in social skills. So it's the only one that it found that perhaps not significant difference. But all the rest, they found something positive on these interventions. So, summarizing what we found here. So as in the previous presentation from Anes, we have similar conclusions. So we have to say that there is very little evidence of good quality on the use of social media interventions for autistic individuals. But all the included studies, exception of one, they have reported positive results of these interventions. But this study that didn't find positive results is one of the studies that was considered of low quality. So, yeah. But anyway, we have to take this into account. So the results suggest that interventions that use social media might be, in fact, a way, a possibility of supporting behavioral change in autistic individuals. And this is that's the list of the main studies that they were included in this review. Yeah, I'm waiting a little. Some pictures are here. And that's it. That's all I wanted to say. Thank you very much. If you want to talk or discuss more about this, you can contact me at this mail. And yes, looking forward. Thank you very much.